So the last set of exercises are in the walking posture. So these obviously require more balance. If you need help, don't do these if you're at a fall risk. That would be very important. And the very first one is the toe walks. So what they do here is very similar to what we were doing on the static activities, where we're going to rise up on a toe and we're just going to walk. Okay. Very, very simple. Probably the best thing to do is set for 30 seconds, maybe even a minute, and just walk on the toes, okay? Now, when you were younger and there was no problems with neuropathy, this is a very basic activity, obviously. But if you have neuropathy and you're really trying to do all that you can to make it better, very, very important activity. Now, heel walk is next. Essentially, we're just gonna go on the heels, okay? And you're gonna walk for, again, time, 30 seconds, maybe even up to a minute. Okay, now I'm walking in a very small area just to kind of stay within this room, but you could walk for distance and that would be totally fine as well. The next activity is slow lunge walks. Now we use these a lot for all kinds of problems that people can have, anywhere from foot and ankle problems to knee issues to hip issues. The significance of this particular exercise is the fact that you cannot, if you do it properly, you can't cheat because there's a balance component to it. I'm going to do just a couple of reps here. So here we go. We're going to basically start in this position here. We're going to take a big step. We're going to go down about halfway, and then we're going to come and stop. And you're just going to balance before you take the next step. Okay, so again, if we do it here, we're going to take a big step. We're going to come up to here, and then take the next step. And you just repeat that over and over again. And what it does is when you first start doing that, it's a really challenging activity. But if you do it, over a period of days or weeks or even month, you'll find that your balance gets much, much better. Your strength of your quads and your leg muscles gets much better. One of the things that I see people do a lot is they'll lose their posture when they do it. It's very important. So when you take this big step, you do not want the upper body to go forward, okay? You want the upper body to stay directly up, just like this. Then you transition and pause. I lost it right there. So again, here, transition and pause, and you have to have control here. If you take that next step too quickly, you don't have control, you're not benefiting from the activity. It's very important. Most people, when they do this in the office, they do not get it right at first. They have to practice it a little bit. All the exercises that we did before this lead up to the ability to even attempt this. This is an advanced activity. If you have balance issues, do not attempt this activity. If you need someone to help you and to basically hold your hand while you're doing it, great. But I will say this, if you can advance to this activity, you will be far, far better than if you could not advance or could not do this activity, because it requires so much balance and strength that you're in a much better place from a fall risk perspective if you can do this as opposed to not being able to do this. So it's great to work up to this, and I hope that you do make this progress, and I hope these exercises have been helpful for you.